In just a month, the cost of health insurance will skyrocket for millions of Americans. With premiums set to rise, some lawmakers who are trying to offset some of that pain by extending the Obamacare tax credits now appear to be losing faith in those negotiations. You might recall healthcare was the key sticking point for Democrats during the government shutdown. Well, then last month, a group of 8 Democrats crossed the aisle to help Republicans end the shutdown. In exchange, they were promised a vote on a health care bill of their choosing. With that vote expected to take place next week, lawmakers say they are still nowhere close to a deal. NBC News senior national political reporter Sahil Kapur joins us now with more on these negotiations. So, Sahil, I know you've spoken with some of the lawmakers who are directly involved in these talks. Democrats are working on their proposal, trying to extend these subsidies that expire at the end of the year. Republicans are working on a counter proposal. What kind of progress has been made since the shutdown ended almost a month ago? What are the key sticking points?
Very little progress, Joe. The basic problem is that most Republicans want these ACA tax credits to expire entirely, so they're struggling to find any sort of consensus within the party about an extension. There are a number of GOP lawmakers in the House and the Senate who want a temporary continuation of these funds, but they are outnumbered. And beyond that, there are some issues that are solvable between the parties, like tightening the income thresholds, requiring voluntary renewals, things that Democrats are willing to negotiate on. There are other GOP demands that simply won't fly with Democrats, like stricter abortion restrictions on this money, which they are insisting on, or pulling it out of the ACA system entirely and sending it to health savings accounts or FSAs. Democrats don't want to do that. And look, as you mentioned, this is the fight that caused the record-long government shutdown. Democrats walked away with no policy concessions there, but they did get a promise from Senator John Thune, the Republican majority leader, to hold a vote on any bill that they decide to put up. That will require 60 votes, so it's likely to fail. Take a listen to what the two leaders, John Thune and the Democratic leader, Chuck Schumer, said about that yesterday.
As I said, the conversations continue. I don't think at this point we have a clear path forward. I don't think the Democrats have a clear path forward, and they're the ones that are going to have to put together their plan to get voted on next week.
Democrats have promised the option to force a vote on the Senate floor next week on any health care bill if you're choosing. What bill will that be?
Stay tuned. We had a great discussion, and I will tell you this. We will be focused like a laser on lowering people's costs.
And, Joe, the Democratic preference is a simple and permanent extension of these ACA funds, but we'll soon find out what they actually put to a vote.
So if that vote, whatever it is, does fail next week, what is the next opportunity for lawmakers to possibly take action on health care? I mean, we know we could see, a government shutdown early next year. Is that also a possibility?
Oh, it's a possibility, Joe. One Republican senator I spoke to said next month, January 30th, when government funding expires again, might be the next opportunity to address this issue. But look, this will have to be in 2026, which is where Congress gets into the business of cutting major legislative deals in an election year, which is always difficult. Bottom line, it only gets tougher from here.
All right. It's going to be a key issue. Sahil Kapur, we know you'll continue to follow it. Thanks.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.